We're going to move into some flexibility now. Setting up for a wall calf stretch, facing the wall, feet are hip distance apart, stepping one leg back for a calf stretch, opening up the gastrocnemius here, driving the heel down as the pelvis drives forward, tailbone reaching away, little lumbar extension. Without pushing the rib cage forward, close those front ribs, plug the shoulders down the back, retract your chin, back of the neck is long, eyes should be focused eye level. And think about your breath. Inhale, pull the abs in, lift up on the muscles that stop your stream of pee, hold that lift, driving the heel down and the pelvis forward at the same time. Again, inhale laterally into the rib cage, pull the belly button in, lift up on those muscles that stop your stream of pee, hold it, sustain it, drive the heel down and the pelvis forward. Keep going with that breathing. Back of neck is long, collarbone is wide. That front knee shouldn't be tracking beyond the metatarsals. Go ahead and step that back leg forward. Start with the legs hip distance apart, stepping the opposite leg back. Look over your shoulder. Is the leg perfectly parallel? That includes the foot. Drive the pelvis forward as you drive the back heel down. On your exhales, inhale through the nose, pull the abs in, brace the stomach as if you're going to be punched in the gut, drive the pelvis forward and the hips and the heel down, exhaling the air out the mouth. Be cognizant of your breath. Your eye focus is also important here so we don't encourage that forward head syndrome. So retract your chin, give me a double chin so the back of the neck is long. Watch out for the shoulders elevating, keep them plugged down. Sternum reaching towards the back ribs, closing, allowing access to the lower abdominals and the upper back. A few more seconds here. We'll move into a quad release on one side, kicking one heel towards your butt, grabbing the outer ankle, dorsiflexing the foot, soft bend in your supporting knee, bone of the big toe of your supporting leg heavy in the floor. Inhale, exhale to drive that thigh back, bracing the abdominals. Inhale, abs in, contract. Exhale, drive the thigh back. 2 more breaths. Inhale, contract. Exhale. And inhale, release the leg, turning and setting up on the other side. We're working on opening up the quadriceps after our cardio burst, all that hard work. Breathe in, make sure your supporting knee is bent softly. The bone of the big toe of the supporting leg is heavy, and you're really driving that thigh back on your exhale. We'll move to the floor for a prone floor twist, setting up a right angle, turning our head away from that right angle. That elbow of the right angle should be in line with the shoulder. Other hand by the chest, keep the head down as you spiral and lift the same leg as the hand by the chest, up and back. The knee is bent, the big toe is on the ground. Dorsiflex the foot to keep the knee safe here. You're getting an opening in the pec minor as well as your hip flexors. Use your exhale as a chance to deepen the twist. Inhale, prepare. Exhale, twist deeper. Inhale, prepare. And here is a great chance to work on those ribs not spraying forward. Even though we're in extension, we want to find our back. We want to bring the sternum in towards the back ribs so that our upper back can fire here and we can pull our abs in to support the low back. Inhale, brace your abs and spiral out of the twist, making your way to the other side, setting up, creating a right angle, elbow tracks right in line with the shoulder, hand by the chest, head is turned towards the hand by the chest, same leg as hand by the chest lifts up, spiraling around, dorsiflex the foot, heel can rest on the ground, but watch that the knee doesn't start to collapse down. Keep lifting up from the top of the groin. The hip flexor will stretch here. Inhale, brace the abs. Sternum reaching towards the back ribs. Exhale, twist deeper. Keeping the head down, the temples should be resting on the floor. Retract your chin to keep the back of the neck long. And make sure you're breathing. Inhale, abs in, lift in and up on the muscles that stop your stream of pee. Fog a mirror as you twist deeper into this nice prone floor pec and psoas opener. From here, we'll move into foam rolling for your IT band. You'll be in a side plank position. Don't collapse into that shoulder of the forearm that's down. Use it as a chance to also condition the lats. We'll walk forward and back, rolling out the fascia on the outside of the thigh laterally. Breathing. You can put that top foot down, either behind or in front, if that's helpful, or if keeping it lifted in the air and stacking the legs feels better, this is also an option. Just make sure you're not collapsing into the forearm, into the shoulder of the arm that's down. Other hand can be behind the head to support it, on the hip, on the roller, wherever it feels like it's out of the way and you can focus on the fascia release of your IT band. Go ahead and switch sides, setting up. And if at any time you have one side that's significantly tighter than the other, feel free to go back. Most of the stretches we're doing now, unless they're a release, are postural, so we're holding for a full minute. So you can stay for a minute 20 or a minute 40 on your dominant side and do a quick release on the non-dominant if it doesn't feel tight. Make sure as you're rolling here, you're not spraying the ribcage forward. We want to always be engaging our abs and our upper back as we work. This will bring us into that optimal alignment and perfect our posture, combat the kyphosis, and help alleviate chronic back pain. 15 more seconds here, finding fascia in the IT band, that overactive lateral chain, the hamstrings, even getting up into the glutes as you roll up top. From here, we're going to come into a rectus opener, rectus abdominis opener, getting into the upper fibers of the internal obliques in the rectus abdominis. Hands behind the head, place the roller behind your shoulder blades, feet on the ground, tailbone reaching towards the feet for some lumbar extension, and we'll allow gravity to do the work as we extend our chest, elbows pointing out to the side, chin retracted. Press your shoulder blades into the roller. This will intensify the opening and the upper fibers of the abdominals where you're overactive. Breathe here. Be cognizant of spraying the ribs forward. Go ahead and push those back ribs and shoulder blades into the roller, intensifying the stretch. Inhale, abs brace. Exhale, press the back ribs, heavy, heavy, heavy. Chin retracted. Inhale, last breath, brace the abs. Exhale, press, 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 deepening and lifting up. We'll grab our ball to lie supine, placing it under our head for a figure 4 stretch, crossing our right ankle over our left and threading the hands through to bring the left hamstring towards the body. Opening that right thigh with the right elbow, dorsiflex the crossed leg foot so that you keep the knee tracking safely. Reach the tailbone towards the bottom of the mat in an effort to keep lumbar extension. And check in with your breath. Breathing in and exhaling. Deep inhale. Brace the abs, pulling that hamstring closer towards you as you open the opposite thigh, using the elbow as leverage. Go ahead and switch sides, setting up for your supine figure 4 stretch. You can also use this as a chance to stretch the back of the neck, giving me a double chin, retracting that chin, engaging your neck flexors to release the neck extensors. Make sure the foot that's crossed is dorsiflexed. The tailbone is down and reaching down towards the bottom of the mat, allowing you to access the upper fibers of the glutes as you pull. The glute med, the piriformis is opening. If you round your low back, you don't get the full attachment stretching. So make sure to try to keep the pelvis neutral and try and accentuate and reach the tailbone down and away from you for a subtle bit of lumbar extension. Just a bit longer here. 5, 4, 3, 2, 1. Our final stretch, we'll grab our heaviest Theraband. You can keep the ball under your head, hooking the band around the arch of the foot, sliding the other leg out long. We'll internally rotate the leg in the hip socket, taking it across the body for a deep IT band stretch. Reaching the tailbone towards the bottom of the mat, dorsiflex that foot, squeeze the front of the quadricep, lift the kneecap. You'll feel the peroneals, the outer calf, the outer hamstring, all the way up to the hip stretching. Do your best to take the rounding out of the lumbar. Imprint those back ribs into the floor at all times. Really activate them so we can turn off the pecs, the anterior delts, and recruit the upper back. Stay aware of your pelvic position, tailbone reaching away, collarbone wide, shoulders plugged down the back. Breathe in, pull the abs in towards the spine, lift up on the muscles that stop your stream of pee. Hold that lift. Bring the leg a little farther across. Go ahead and switch sides, bracing your abs. Setting up. Internal rotation of the leg from the top of the hip socket, crossing the body. Dorsiflex the foot evenly from the outer and inner edge. Reach the back ribs into the floor, pressing them heavy, shoulder blades heavy into the floor. Chin can retract, lengthening the back of the neck, engaging your neck flexors. Tailbone reaches towards the bottom of the mat. Inhale. Brace your abs as if you're going to be punched in the gut. Deepen the stretch, dorsiflexing, squeezing the front of the quadricep, and moving the legs subtly a little farther into the stretch. Inhale. Brace. Moving deeper into the stretch. Inhale. Abs in, contract them, hold the contraction, and exhale, deepening the stretch. Moving out of it with awareness, keeping the abs braced. Good job.